the U.S. Open Health Desk presented to you by Mount Sinai. I am your host, Shauna Ryan. Joining us today is Dr. James Gladstone. He is an associate professor of orthopedic surgery at the Icahn School of Medicine and co-chief of sports medicine in the Leni and Peter W Department of Orthopaedic Surgery at the Mount Sinai Hospital. Dr. Gladstone, thanks for joining us today.
Thanks for having me here.
Well, obviously being here, we all enjoy the game of tennis, but it can put some stress on our key joints like our hips and our knees. So with that in mind, who are typical patients who often come in for joint or cartilage replacements?
So you have two groups of patients. One are the people who have acute injuries, and by that I mean they twist the wrong way and they feel a snap or a pop in their knee or their hip. Or you have ones who develop it over time from repetitive overuse, which is probably in tennis the more common way to injure yourself.
When a patient comes to Mount Sinai for some of these ailments, what's the typical course of action? What's the typical treatment?
Obviously, the first thing you need to do is make the diagnosis, and that can be either something coming from the joint or from around the joint. If it's coming from the joint, for example, in the knee, it's a meniscus tear or a ligament injury. If it's around the joint, it's usually a tendinitis or a muscle strain.
What about viscosupplementation? What exactly is this? How long does it last? Is it something people should be asking about?
It's a gel that you inject into the knee joint, and it interacts with the cells of the joint lining, something we call the synovium, and gets those cells to produce a better, thicker fluid. One of the issues is in people who develop arthritis, the normal joint fluid they produce is thinner and more watery. So if you can improve that viscosity, that thickness of the fluid, it can provide better lubrication. So it doesn't cure anything, but it treats the symptoms of pain and swelling. One other option we have now is something called PRP, or platelet-rich plasma. What that does is it helps in the anti-inflammatory process and even potentially in the healing process by stimulating the body to heal itself. So almost sort of supercharging the cells that work in the healing process.
Are there any supplements or anything else that players who are watching can do to keep their joints healthy if they want to be preventative so they don't come to the place where they need these things?
I think staying healthy and well conditioned is really the most important thing. I don't think there's anything you can particularly take that avoids injury. There are things you can take once you're injured to help heal yourself. But staying flexible is the most important thing, especially as you start getting older, because one thing that happens is that your muscles, tendons, and ligaments get stiffer. And the stiffer you are, the more prone you are to injury.
Well, Dr. Gladstone, thank you so much for coming today and help keeping our joints nice and healthy on the court. We appreciate it.
My pleasure. It's a lot of fun.
And don't forget, you can check out usopen.org throughout the entire tournament for more great information from the staff at Mount Sinai. Until next time, I'm your host, Shauna Ryan. We'll see you right here on the U.S. Open Health Desk presented to you by Mount Sinai.